A very warm welcome, everyone. I, Dr. Nishant Sharma, on behalf of Voice of Healthcare, welcomes all the viewers who've joined in for our virtual series. Voice of Healthcare, in collaboration with Espera Nutrition, has taken an initiative to bring together an interview series talking about the importance of nutrition during oncology treatment. Today, we have with us a very special guest, Dr. Vivek Agarwala, who is Director and Senior Consultant, Department of Medical Oncology and Hemato-Oncology, Narayana Health, Kolkata. Good evening, Dr. Vivek. A few words of self introduction, please.
Yeah, hello everyone. My name is Dr. Vivek Agarwala, and I am a medical oncologist and a hemato-oncologist at Narayana Super Specialty Hospital, Howrah, and RN Tagore Hospital, Kolkata. And many thanks to Voice of Health and Aspira for giving me an opportunity to connect with your audience. Thank you.
Yes, sir. So I think we'll start with a set of questions. I hope you're ready with the answers. So,
Yeah,
setting up
sure.
the foundation of today's discussion, to start with, I would want to hear your perspective on why nutrition holds such a crucial role in the journey of cancer patients, and also how does the patient's nutritional status determine the ability to cope up with the treatment and the overall well-being and the treatment outcome that we see in onco cases. Over to you, Dr. Vivek.
Yeah. So we must always remember that cancer itself is a condition which is very closely linked to the nutritional status of any person, because cancer patients do have a derangement of nutrition as well as nutritional parameters, just as the pathophysiology of the disease goes, because wherever the cancer is, it has its certain biochemical factors which are released from the cancer cells, which has systemic effects, thereby decreasing your appetite, decreasing your ability to intake food, your ability to enjoy food, your weight goes down, your the nutrition level goes down, your muscle mass is lost, your albumin levels go down, and this as a whole takes a big toll on the overall health of the person. Now, one of the biggest challenges for cancer treatment is it does have certain side effects and
Mhm.
does require a good health to tolerate the treatment, to go through the treatment. The treatment is itself slightly, you know, tougher as compared to other ailments. It is prolonged, and that is the reason why the treatment itself brings in all these effects too. Decreasing your appetite, increasing nausea, vomiting, your ability to take food, enjoy food,
Mhm.
your appetite goes down. And
Mhm.
if all these go together hand in hand, it becomes a vicious cycle where your health goes down, and further your appetite goes down, your cancer doesn't respond to treatment,
Mhm.
uh, uh, your health further goes down, and it goes on in such a vicious cycle. So nutrition is very important in order to break this cycle, because once you are nutritionally good, you are well nourished,
Mhm.
then your body is able to cope up with the treatment well. There are less treatment breaks. There is better ability to take the treatment. Side effects are less. Responses is better,
Mhm.
and the treatment is more successful. And this is already proven in terms of clinical trials, where results have clearly shown that patients who have malnutrition tolerate treatment less, as well as their outcomes are inferior, their survival is less, whereas those patients where nutrition is better, they survive more. So that is the
Mhm.
reason why there is all importance on nutrition. And
Right.
I would just add one more point, that by nutrition we always talk about weight loss. We always talk about weakness. We always talk about eating less, but in fact, even obesity is malnutrition. And patients who are obese also do not tolerate treatment well. Patients who are obese also have been shown to have more side effects of treatment, and patients who are obese also have a inferior survival of
Mhm.
treatment. So even balanced nutrition is also very important. And obesity, just as we talk about in other fields, that even in a cancer patient, obesity is bad too.
Right. Very, very nicely summed up, Dr. Vivek. Building on side effects. So let's talk about the management of these side effects, and I'd like to hear your views on how does the collaborative effort of nutritionists along with medical and the oncology team helps in maintaining and controlling the side effects that often come across while someone takes oncology treatment.
Correct. So one of the important factors while an active oncology treatment goes on is, for example, mucositis. So what is mucositis? Is like there is inflammation in your mucosa, which is there, lining the oral cavity as well
Mhm.
as your gut. So as
Mhm.
your gut is inflamed or your oral cavity is inflamed, taking oral feed is becomes difficult. And if you take anything, you have diarrhea, and all those problems can come. Now here again, the nutritionist comes in, because they help me give a diet which is more suitable for such a mucositis patient who is having side effects, and which is more tolerant. And sometimes
Mhm.
when patients are not able to tolerate oral feeds, there is a role of intravenous nutrition or parenteral nutrition, where we give the nutrition via injections. And
Mhm.
that's how the side effects are taken care of, while nutrition is also taken care of. Again, nausea and vomiting is very important as one of the side effects. And then
Mhm.
again, there are foods you need to identify which contributes more to nausea and vomiting in the patient. It can be
Mhm.
different for every patient.
Correct.
Suppose there is diarrhea, then obviously you need to look at what dairy products patient is taking, whether the patient is taking milk or milk based products. And if patient is having diarrhea to certain known products, and you have to
Mhm.
remove them from the diet. And
Right.
again, if the patient is diabetic, and then you need to look at you modify the diet accordingly. Suppose the patient has infection, there also you need to look into what foods, or if the patient is at risk of infection, there also you need to modify the diet, that look, this chemotherapy regimen has a higher propensity for infection.
Hmm.
So you have to have a strict diet control, a strict diet modification, whereby you remove patients having raw vegetables or
Right.
raw foods which have more chances of infection, or fruits or vegetables raw which have a very thin peel.
Mhm.
So at every and each step of cancer treatment, when we talk about any side effect, there is a dietary management. And
Hmm.
nutritionist does help us a lot in managing these issues.
Very, very insightful, I think, an answer which sums up that it's a collaborative approach between a dietitian and an oncologist while an ongoing oncology treatment is going. So I think while you were just discussing about so the thing personalized nutritional plans, because every cancer case is unique, every side effects that a patient portrays are unique. How do you feel that tailoring the nutritional recommendation per case or per patient changes? How does it change? And I would also want you to give an example of where you would say that a personalized nutritional plan was put in place by you and the working nutritionist, and the result that we saw with that particular case. Over to you.
Correct. So, just as I told in the earlier questions, that there is a proper nutritional plan that can go with each and every patient, depending upon the diagnosis, depending upon the kind
Mhm.
of treatment that we are giving, depending upon the current nutritional status of that patient, as well as the kind of complications that we are seeing or that we are expecting also. So
Mhm.
based on all these factors, it is recommended that a personalized nutrition plan is drawn for each and every patient, and we do refer our patients to nutritionists to look into all these factors, identify what are the areas where the patient is lacking nutrition, so that we can supplement those, and what are those special nutritional recommendations that patient needs, which can be taken care of. And there are several examples, and just for one example, as you told, that recently one of our head and neck cancer patients, who was undergoing a definitive chemo radiation, and just starting chemo radiation, the patient had a heavy weight loss of 6-7 kgs, almost 20% of his body weight within the first week itself, because of the side effects, and the pain. He was unable to take proper diet, and we all got together, we started IV nutrition for this patient. We got our nutritionist in, we put in Riles tube for the patient, and we worked out what are the specialized formula feeds that we should be using for this patient. And within a week we had wonderful results, whereby this patient gained 3-4 kgs of weight. He was feeling more strong. He was more determined to sort of restart the treatment. And once we were able to break the cycle, and there was increase in weight, we were successfully able to complete the treatment. And he had good results eventually, whereby his subsequent scan showed a great response to treatment, and he was able to complete the treatment also in time. So we were able to make up for the loss of treatment that he had because of the extreme weight loss.
Right.
So such kind of collaborative efforts do pay. And nutrition itself is something like an emergency also. It is also some kind of an emergency, where you need to act in an emergency manner in a cancer
Mhm.
patient, if you want to save the patient, if you want to really improve the patient fast. Otherwise it can affect the immunity of the patient. Some infections can come in. Sometimes it
Mhm.
can be fatal too.
Right. Thank you. Thank you for this educative example that you gave. So, moving over, I think, to the last part of my interview with you, I'm going to be talking a lot about post treatment nutrition. So, I'd like to hear your views on, let's say, that a patient has completed their treatment. And now, how does nutrition play a role in the recovery that a patient sees, and any key takeaways that you would want any oncology patient who has undergone their treatment in the past to create an awareness, right, of this question? So over to you.
Correct, correct. So it's a great question, Dr. Nishant. And there are two kinds of situations that we face. In fact, three kinds. First one is obviously a patient who has completed a very intensive treatment. He has lost his weight, so he will need a rehabilitative plan to catch up for the lost weight that he has had, in order to regain the strength, regain the health, the weight that he has lost. And then there are patients who will have an optimal sort of health, who has had tolerated treatment well, uh, where you are more worried about a weight gain in the future. And as well as sort of patients where you already know that there is a risk of metabolic syndrome and weight gain, and hypercholesterolemia and diabetes and all those kind of cardiovascular complications as a known late complication of the treatment that you already have data about. So there are those kind of cancers where you already know that these are long term survivors, but as long term survivors you need to again take care of them, because they are at much higher risk of having cardiovascular diseases later on. They're at a higher risk of stroke, they're at a higher risk of myocardial infarctions, and on those problems. So I think gaining the health is not very challenging once the treatment is completed, especially in curative cases. But what is more challenging is stopping the weight gain, asking your
Mhm.
patient to sort of exercise, not let the weight increase more, encouraging them to go for weight loss, to
Mhm.
sort of monitor their blood pressure, their diabetes status, as well as their heart. So this is something that
Mhm.
is very important, and this is what I would like to sort of stress upon for all the cancer survivors out there, that do remember that all cancer survivors, as a result of your past treatment, whether it was radiation, whether it was surgery, whether it was chemotherapy,
Mhm.
most of these patients and most of the diseases have shown that these survivors are at a higher risk of cardiovascular diseases in future. And you need to take care of this heart, your heart also,
Mhm.
because as we all say that India is the diabetic capital of the world. Slowly we are sort of talking more about cancer, how it is becoming cancer
Mhm.
capital of the world. So you should not
Mhm.
forget that cardiovascular diseases and diabetes and all these
Mhm.
are still the number one killer diseases, and our cancer
Right.
survivors are also more and more at risk of these events too in future, and we need to sort of keep their weight and nutrition in check in those respects also.
Right. I think, talking with another oncologist the other day, and they were also mentioning a very similar aspect to what you just mentioned. That any patient who has now undergone the treatment would want to get back into the normalcy of life, go out partying and try to regain back the days that they have lost. But a
Correct.
very educative, and I think a very nicely curated message for all the cancer survivors. So, just a last couple of lines from you before we wrap up this session. Any key takeaways or any message that you would like to give to all our viewers on this National Nutrition Week, Dr. Vivek?
Yeah, I think I thank Aspera Nutrition as well as the Voice of Health again for giving me this opportunity. And if in one line, what I have to say to all my viewers is that watch what you eat. It is very important, and each and every thing that you eat, it's very important. Nutrition is a very important part of life, and every disease there are significant, there is research going on into nutritional therapies, and how with nutrition, a proper nutrition plan, we can add so much significantly to the treatment process that it helps your treatment in a very significant way. So watch what you eat and read about it, know about it more, enjoy your food, and keep things in check.
All right, all right. Thank you, Dr. Vivek, for stepping up and promoting our cause of creating awareness on this National Nutrition Week. I'd like to thank all the viewers who have stepped up and engaged with us. And with this, I'd like to bring the session to a closure. Thank you, Dr. Vivek, and
Thank you.
have a good day. Thank you.
Yeah, thank you.